Well, for more on this, let's go live now to Professor Boyd Swinburne from Health Coalition Aotearoa. Boyd, thanks so much for joining us tonight. We don't often hear this, do we? Obesity rates going down. Did those results surprise you, and what do you make of them?
Kia ora, Ingrid. Yeah, that was interesting, but it is a continuation of a trend that we've known. And as you say in your news break, that this is a piece of good news. Trends have been going down in the preschoolers, and the disparities by socioeconomic status and by ethnicity have been reducing. But I'm afraid I do have a couple of pieces of bad news. Don't want to be the Grinch here, but I do have a couple of pieces of bad news to bring. First of all, that trend has been happening in preschoolers for 10 years, and yet the obesity levels in school-aged children has virtually not changed. So whatever happens is happening right in the preschool environments is being lost in the school years. So that's the first thing. And then secondly, this paper that's just come out was up until 2019, which was pre-COVID. Now we do have the results of the New Zealand Health Survey, which goes up to 2021. And unfortunately, we have seen a big upspike in obesity levels, not only in children, but also in adults, and other countries have seen that trend as well. So for both of those things, the continuing downward trend in preschool kids, the reasons that it doesn't punch through into school-age kids, and this big upspike in over COVID lockdowns, that raises a lot more questions than it answers, to be honest. And we're still digging around trying to work out what the causes of these trends are.
Do you have a view on what the causes might be? Because researchers were puzzled by that.
Yeah, and we tried to find anywhere else in the world where we've seen a reduction in these disparities, in these inequalities, and reduction in obesity over time. And actually, we haven't found any country that has done that. So that is really unusual. My best shot at the hypothesis is that it's occurred at a time when there's been increasing access to preschool care, to daycare and so on, childcare. And I think that we know that that's good in a good environment for kids, and that may have been part of it. But honestly, we just don't have the data to be able to be sure.
Okay, just quickly, 1 in 3 children still overweight. What could we be doing better?
Oh wow, that's I know it's still huge. But there are two things that are right on the agenda right at the moment. One is healthy food and drinks in all schools. So the government has a consultation out at the moment asking for input into that. And we believe that that should be across primary and secondary schools, food and drinks. Anything that the school serves should be healthy. We want to give these kids the best start in life. And the second thing is the government has talked about a law around restricting junk food marketing to kids.
Okay. Two things worth noting. I'm going to have to leave it there. Thanks so much for your thoughts tonight, Boyd.
Okay, no worries. Bye.